Most people are in the normal range, but every single human being is going to think they have a small penis. And a lot of it probably has to do with, as men get older, they're more likely to have other medical problems. Erectile dysfunction actually is an early warning sign of heart disease. There's so much information out there that, like, what is men's health? The vision of what we wanted, and we're still trying to reach that, is more of a comprehensive men's health clinic. Humbling thing about being a doctor is that you've just met this person 5 seconds ago and they're telling you everything. Porn can have some issues, right? Typically takes about 24, 48 hours for sperm counts to go back up.
What if you wait more?
Ladies and gentlemen, welcome back to the Two Fries Podcast, aka the #1 podcast in Winnipeg, where we document the rise and stardom of Winnipeg's talent and personalities. I just checked the analytics here, and it turns out that 83.4% of people listening to this podcast are not subscribed. Now that's a problem, and our goal is to get that down. And the reason is, not only does it give us a reason to continue putting on the show, but it also gives us a reason to put the city on the map. Today, we talk with Dr. Premal Patel from Men's Health Clinic in Winnipeg to debunk the top 10 myths of men's health. We talk about a wide range of topics, starting from does wearing a hat lead to hair loss, all the way to does watching pornography affect your performance in the bedroom. As always, if you gain any value from this episode, please hit that subscribe button. There are also timestamps in the description, so feel free to jump throughout the video. And as always, subscribe, and I'll see you next week.
Well, doctor, thank you for thank you for having us here.
Yeah.
In your fine establishment, I may add.
Yeah.
This is where you work out of, correct? This is your home. Is you almost your second home, you would say?
Yeah, pretty much. I spend most of my time here, and I split some time between HSC and here as well.
Okay. Well, I mentioned before the episode we want to dive into the top 10 myths of men's health that I found on the internet. These are not from me. These are what I found on the internet.
I promise there's no personal question that I don't want to
Asking for a friend.
Yeah, I'm asking for a friend. Yeah.
But I'm asking for it.
I'm going to start off with the first one right away, and this has been a topic that we've talked about before as well. But the first myth that I found is your testosterone levels are fine until if your doctor doesn't mention them. So if your doctor doesn't mention your testosterone levels, are they fine?
I mean, it's a good question. Like, what does fine mean? I think the biggest thing that, we're still trying to understand is that what are the signs and symptoms of like low testosterone or testosterone deficiency? It's so variable. And it could be because it could range from what you would commonly think like sexual dysfunction, like erectile dysfunction, or having a low sex drive. But what if it's mood? What if it's cognition, like cloudiness? So what if it's just fatigue? So there's such a variety of symptoms with testosterone deficiency. So it may not be that your doctor didn't mention it, or maybe it's something they think about, like your thyroid. So I think nowadays we're starting to be more aware of, testosterone-related symptoms, and maybe I should get tested.
Yeah, of course.
That's something that I actually, like, when I was looking and doing some research on men's health and the clinic itself, you guys actually test that here as well, right? You take blood samples and you can kind of test the testosterone levels through the blood samples here in the clinic?
Not at the clinic. So we do just through like the basic lab in the province.
Gotcha.
But that's how you get it tested, right? Just a simple blood test, and what they'll do is they'll measure your testosterone levels just to see if they're low. I think the one trouble is when it comes to any blood test you do, there's reference ranges. But is your reference range going to be the same as someone who's 20 years older than you, someone who's maybe 5, 10, 15? But we use the same reference ranges. So we always have to take everything into context of each individual patient. So if we look purely at, say, testosterone values, I may look at your results and say, hey, it's not red, it's in the normal range. But that may not be normal for you, right? So we do kind of take into that sort of context of like age-specific cutoffs. So that's not really typical. It's, again, something new that we're still trying to understand.
This is something that, in the world of social media, it's been talked about a lot. People like Liver King are coming through. Are you aware of Liver
100%.
if you're jacked or eating red meat, you've got the high testosterone.
Right. And then people are, and also in the bodybuilding world as well, we've talked to some bodybuilders on the show and them talking about steroid use and getting their testosterone levels checked regularly. Is there a certain periodic time, a certain age, a certain time when we should start considering it?
Great question. We have no idea, right? Like, because they're, unlike sort of, say, cancer screening guidelines where, there's robust data to say at what age should you start getting your prostate cancer, your blood test looked at. Testosterone is a little bit different. So should everyone just go for a testosterone check? Well, what if you're asymptomatic? What if you have no symptoms? So we don't know, right? So I think it's more of that if you're having a lot of signs and symptoms that may lead to, or that you may think testosterone deficiency, or your doctor does, get tested, and that's where we sort of use that. But rather than just sort of blanket testing everyone, we don't know if that's sort of the way to go.
So what are the common signs of our testosterone deficiency?
Yeah, so it could be the sexual side effects ones, so
Yeah.
or the deficiency. So maybe you're having some issues with erections, maybe your sex drive, and then we think about like your energy. So having some issues with fatigue, unable to develop poor muscle mass development, cognition, so mood could be altered. Maybe it's cloudiness, so those sort of symptoms.
Okay.
Yeah, you're a true doctor, as I may say. Well, we were talking earlier that you've been in practice for a very, very long time. Maybe touch on how you got into medicine. Why?
That long? I'm still young.
No, sorry. What got you into the world of medicine? How did you decide that this was the route you wanted to take?
Yeah.
I mean, just like any good Indian boy, kind of follow the
Parents say it?
our parents teach you. But after you kind of obviously education was very important when I was a kid. Kind of grew up with that mindset of working hard in school. And then once you start, as you guys probably know, once you go through university, you start seeing some of the science classes. You kind of get more interested in it, getting more involved in like patient care, and then it's just sort of steamrolls. And then I picked urology because urology was sort of more, when you go through medical school, people don't kind of know this because there's so many different specialties, and I didn't know this going through medical school. But then once you rotate through different services, you start realizing, do I want to do surgery, or do I want to do medicine? Like, do I like operating? Do I like working with my hands? So then you start realizing, I like surgery. And then within surgery, again, huge breadth of what you can do, right? And so then you start figuring out what do you like. And then what I really enjoyed was working with the urologist, especially the conditions that we treat. They tend to be those that affect a lot of patients' quality of life. So you can make a lot of big differences. So that's kind of what led me into urology.
Well, what was the reaction when you told your parents that? Because it's a very particular stream of medicine to go into, right?
Yeah.
Usually they look at, just check the person's knees and make sure their vitals are good, and you're a doctor.
He's an engineer, by the way.
Yeah.
So some of the terms I use, I apologies for that ahead of time. But what was the reaction of your parents in terms of explaining that you're going to go into this?
They still tell their friends I'm a cardiologist. So no, they're proud. They were happy, right? At the end of the day, like you guys know, I think parents are always happy as long as their kids find their way. So they were obviously super ecstatic and very supportive. So it was pretty easy.
Yeah, that's awesome.
I want to go into the second one, the second myth, that having a man bun or wearing hat leads to hair loss.
No, that one's a no-go there.
And the reason I was looking this up, my mom always used to tell me that. She's like, don't wear a hat. You're going to go thinning or you're going to go bald. That is, you can confirm.
Yes, definitely a myth on that one. But 100%, definitely a well-known myth out there.
Why do you think that is?
I think it's just more pressure, right? Probably just like man bun, you're kind of stretching out the follicles, or it's probably just parents not liking the man bun.
That's true. I'm trying to grow mine out, and my mom's like, please get a haircut.
I mean, like when I'm wearing hats, like, hey, like that's something that I think about, because traditional parents, they're like, don't wear hats too much, or even like beanies in the winter. They're like, you're gonna start losing hair. And then my uncle, who's already starting thinning in his hair, he's like, just wait until you're my age.
Oh yeah, all those days that you wore a hat that you wish you could have taken advantage of that head of hair. Yeah.
Exactly.
Do you have people coming in asking about that, like especially male pattern baldness, stuff like that? And
Yeah, sometimes I think it's it'll be sort of a byproduct of it, the conversation. So someone may come in for something completely unrelated, maybe erectile dysfunction. We'll talk about that, and at the very end, maybe they'll get into a little bit of the hair. So not very often, but those conversations. I feel like those conversations start coming up more, especially when they come to our clinic. They're like, okay, we do some aesthetics here. So those conversations make their way into the conversation at some point.
what are your thoughts on the hair transplants that are going on a lot overseas and not here in North America, I don't think.
No, see, there's quite a few places, and even in Winnipeg where they do hair transplants. A lot of places, certainly a role for it. I think the biggest thing about any of these sort of aesthetics, a lot of times you're going to have to keep it. It's a maintenance thing, right? It's very rare if it's a one and done sort of thing. Even when we think about hair transplants, I'm not an expert in that field, but just even my rudimentary understanding of it, there is a bit of maintenance that may involve. So as much as these things may say, hey, get your transplant, you're good to go, there's still a maintenance process. So if you're going to do something like that, just be prepared to be committed to what it entails.
Was that having like different sides of the medicine world where, you could talk about ED with your doctor and then you could also talk about hair loss? Was that what Men's Health is technically what you envisioned for the brand at least, or the clinic, or was that something that you just do to the business itself that you kind of incorporated just to show like, hey, for example, I have a car wash, but I can also give you air fresheners, right?
No, it's a good question. I think it's just one of those things that we sort of, when we developed Men's Health, it was about, those common men's conditions. But then also men are looking for aesthetics options outside of a common cosmetic clinic, right? They don't want to sit in a clinic where there's, a bunch of other women there and they kind of feel more, it's very common for a lot of guys to say, I feel more comfortable having it. So that was more of a idea that we thought of in the beginning. I think what the vision of what we wanted, and we're still trying to reach that, is more of a comprehensive men's health clinic. Just you're talking about like a testosterone, like when should I get tested? I think we really want to focus on not just dealing with the problems when they start. How can we be proactive with this? And I think it's kind of a lot of where healthcare is kind of go, because right now we're very reactionary, right? Someone comes in, they already have low testosterone. Sure, I can treat that. But where were they 5 years ago? Where were they 10 years ago? Where could we have potentially been to not even get to this conversation at this point? Could we have had those conversations about exercise, diet, weight loss, trying to prevent that in the first place? So that's kind of maybe the long-term, maybe the grandiose vision of where we like to go. But at the same time, we'll do some hair at the same time.
It's interesting you say that, because when I was in probably grade 10, my beard never used to connect. And I was like, Mom, what do I do? I need my beard to connect. She's like, just take time. You'll get there. You'll get there. And I would say, it's an important part, especially like, you're trying to look good. You're trying to, you're trying to go to school. You're trying to look good, trying to impress some ladies here and there. So having that side, and especially in the world of the way that technology has probably advanced over the last couple of years, having that option for a hair transplant or a beard transplant, it probably opens a lot of doors, and what opens, some people may not know that that's a thing. Was there anything in terms of like opening doors and figuring out, was there anything throughout your career that you were shocked by and that you realized once you got into the world of medicine, you're like, hey, that's actually something I didn't expect, or I didn't even know?
I think it's probably the not knowing. I think, just probably comes to anybody, obviously you guys as well, is that once you know more about something, you start realizing how little you know, right? And I think the more, specialized you get, the more you realize you don't know. And there's so many questions that are left unanswered. It may not be a great explanation, but it's just like everything. When I think about, male fertility treatments, as much as people come to me looking for answers, sometimes I may not have any. And that's the one thing about kind of medicine, probably everything that's humbling, is that once you become more specialized, you're like, wow, I really don't know a lot of this. But unfortunately, a lot of people don't know, but that's where the research and all that kind of comes in as well. But I think that's kind of, as I kind of progress more and more down, you start realizing that we just don't know a lot of things and we're still learning.
Does that ever like have any pressure on the doctor themselves? Like, for example, if a client walks in and they ask you about testosterone boosting, of course you have the knowledge now, but if you tell them, oh, I don't know, and their reaction is like, well, you're my doctor, you're supposed to know. Does that pressure ever get to you at points?
Yeah, I think most people are pretty reasonable. I think the pressure that gets to me, and probably a lot of doctors, is right now it takes so long to see a specialist. So I may have someone waiting several months just to be told I don't know, right? So I sometimes I feel very I feel bad, right? Like I feel like patients come in and they may have a complaint, and you reassure them it's nothing obviously overly concerning. Maybe they just want to know it's not something scary going on. But then what is causing it? Why do I have this? And sometimes you don't know, and you feel like, should I know this? Like sometimes you're like, am I not smart enough? Do I need to? So I think that's I think there's a couple parts of the piece is that people wait so long just to see you, and you sometimes feel that you're letting them down, and you may not. You kind of feel it though. So I think that's a piece that can be I struggle with that sometimes.
When you first started doing your practice, how is that compared to now, let's say, as you get more and more specialized?
I think you become more comfortable saying you don't know, because you've seen it so often. You go to a lot of conferences, we do a lot of research here, you speak to a lot of other experts around the world, and you're like, actually, they don't know either, right? So it's a little bit more like you become more common saying, I don't know, but I know there's no one else that knows either, right? And it's one of those things that you kind of just become more confident in sort of your responses. And because once you practice for 3-5 years, you've done enough to have seen some bad outcomes, some good outcomes. You just feel more confident. It's just experience. So I think that becomes more, and I'm sure, 5 more years down the road, it'll just keep progressing, right?
There's I'm going to put you on a spot here a little bit, but in terms of when you going throughout med school, you're learning a lot of things, right? A lot of information is coming your way. Some people say it's like drinking out of a fire hydrant. And you're just absorbing as much information as you can. And you're trying to retain as much as possible. Compared to one of your first times when you're actually dealing with a patient, is there a moment that sticks out where the first couple times when you first interacted with a patient, or the times when you were doing your residency, for example, that you realized, oh my God, like, this is real. Like, I'm doing this right now. A realization moment that I am a doctor now. I am responsible for this person's health.
Yeah, no, 100%. Like, there's no safety net, right? Once you start practicing, before, when you're a resident or you're, resident, just people know, like, after you do medical school, you'll do a residency, depending on what the residency is. Most surgical residencies are 5 years, so we spend 5 years in the hospital. And so, like, I did 5 years of a urology surgical specialty. And then you do a fellowship, which is like subspecialized training. So I did mine in male infertility and like sexual medicine down in Miami. Yeah. So during those periods, you have someone there to back you up, right? Yeah. Even when you're done your residency and fellowship, you are a licensed urologist. But if you have a question, hey, I got the boss here, I can ask. But then there's a quick transition period where you are the boss.
You're the boss.
You're the boss. So, I think it's more of you kind of have to take with what you learned and kind of but it is a bit of a process. But that's why I tell this to a lot of residents and who are asking me about where should they go for their fellowship. Go where the people that train with them still talk to their fellowship people, right? So I consistently talk to my fellowship director, a year or two after even starting practice, because he would always still be a mentor. So even though those times where you have those tricky questions or cases, it's just important to have a collegial group. So you always feel like you're always backed up.
That's very wise. Third myth that we're going into: there's no safe way to boost your testosterone levels.
I guess it depends on what do we mean by safe. When we think about like testosterone replacement therapy, so we do a lot of TRT. So that could be like injections, gels, you name it. That is a safe way, right? Like realistically, you do proper TRT, right? You're measuring your blood work. If you're doing injections, you're doing it properly. You're cleaning the area. That's a safe way of boosting your testosterone. Now, is there a way to naturally boost your testosterone? That's probably probably what we're getting at.
Yeah.
We don't really know, right? There's all these boosters that are on the market. A lot of times, a lot of these supplements, supplement market is highly unregulated. We don't know what's in it. Not great data for it. So something that we don't really know. But so in that question, we don't really know if there's no natural ways. I always tell patients in terms of just lifestyle aspects that can help over time with sort of getting that testosterone up, and that could be getting proper sleep, diet, exercise, weight loss. So those are definitely the important pieces.
So when you talk about natural ways to go about it, a lot of people, or at least the ones that are not in the medicine world, they say if you're injecting yourself with testosterone boosters, that's not a safe way to go about it, right? That's not natural, quote unquote. What are your thoughts on that?
Yeah, I guess it all depends on what we're talking about, right? Like natural, for sure. Like if you inject yourself with like exogenous or testosterone, it will shut off your own testosterone production, right? But in many cases, it's a vital, replacement hormone. I have some patients, they come in and their testosterone is low and they're like, what can I do about this? And I'm telling them, well, get back in the gym, start exercising. They're like, I'm so tired. They're like, so you're trying to tell someone to lose weight and exercise when they don't even have the energy to do that. So that's what I think about the testosterone replacement, is trying to boost them up, give them the energy back to make those active changes in the lifestyle. And I've seen a lot of patients who, they've taken that and they've ran with it, right? They feel so much better. They're going back to the gym. Then you have other patients who don't, right? They're like, I like how I feel. Haven't really changed my lifestyle, but maybe I'm going to have to be on TRT for life, right? So there's kind of different ways of approaching it. Ideally, you replace them, get them back to kind of as much as peak health as they can, maybe slowly wean it off. And then there's going to be some people where it's going to be hard to wean off.
I guess it also depends on the type of person coming in, correct? Like someone who may just want to be active versus someone who's trained for a bodybuilding competition, right? In the world of, let's say, like muscle mass and like getting your summer body right, or looking, is that a route that people come to you and ask you about, like saying that, hey, listen, I've been trying to gain muscle for this many years, I want to get bigger? This is
Not really.
No.
I would say, 9.9 times out of 10, the patients that come in are going to be those who have some of the signs. Certainly, there's going to be some patients who are looking for that.
Yeah.
We have pretty strict guidelines in Canada, and people may find them pretty restrictive because of how the testosterone is sort of regulated. So we have to be careful with how we prescribe testosterone. So we do make sure that they have either like biochemically low testosterone or a combination of signs and symptoms. But very rare will patients come in looking for trying to get that beach bod going.
The reason I ask is because the next myth is saying that protein shakes are the only way to build muscle. True or false?
I mean, you need protein. You need protein to build mass. But you need the exercise on top of that. But I mean, protein is it is the foundation of it.
Yeah.
You got to make sure you're consuming a decent amount. Usually a gram per pound, right? Of just making sure you have adequate protein. So. I think, whenever patients come in, when we talk about going to the gym and exercising, apart from just getting into the gym and exercising, is obviously part of that is the proper nutrition and just making sure that, if you are going to the gym, you're taking proper recovery, you're getting the protein in and so forth.
Well, we were talking about natural testosterone boosters, and one of the myths, I think a lot of the sporting world, or at least a lot of the fighting world, before they go into the fights, they do their sperm retentions, right? So they basically retain it, and that allows them to boost their testosterone. They would say they feel stronger, they feel more
Super Saiyan or something?
Yeah, they feel like Super Saiyan. What are your thoughts on that? Or more particularly, there's a special month, the No Nut November.
I mean, you guys are probably too young for Seinfeld, but like, there's a point where George Costanza didn't. Yeah, exactly. Yeah, he didn't.
He's older than us.
Yeah.
Dino knows.
He didn't have. I think he didn't ejaculate for a while, and so he just felt like superhuman at that point. Yeah, and there's no evidence for any of that. Yeah. Unfortunately, not. I mean, it's too hard to do a study or anything like that on that. So I wouldn't say there's much value in that.
Good to know. Because are you a fight fan at all? Or
a little bit, not really.
Okay, because we were just watching the Ryan Garcia versus
Devin
Haney fight, and so there was talks about, I think before any major fight, there's always like, oh, you're on steroids. No, I'm not. You're on steroids. So obviously they all get tested, and USADA or whatever the company is, they test it. But it's always an interesting conversation to see that in the sports world, it's not always regulated, especially if we go back into boxing or combat sports or even other sports, it wasn't regulated at all.
Yeah.
So
yeah, absolutely.
Right. And then now all of a sudden there's so much science behind it. There's so much research. So that's very interesting. The next myth that I have here is that men's health is not responsible for reproduction rate.
Sorry, say that one more time.
I'm going to give you the exact word. Men's health has no effect on reproduction. So being healthy as a man or has no effect on the ability to produce sperm or reproduce.
Definitely a myth.
Myth.
Yeah, when we think about fertility as a whole, so like 1 in 6 couples struggle with fertility, and then up to 50% can be a male factor.
Okay.
And then when you break down that male factor, a pretty decent chunk could be male just lifestyle, right? So think about, when we think about diet, exercise, weight loss, all these sort of things, but like men who are obese or they have higher, fat, they will convert a lot of testosterone to estrogen, right? And so a lot of that can cause issues with your reproductive system. So there definitely is a correlation with respect to lifestyle being really important. So definitely anytime patients come in, especially with fertility concerns, we do really heavily discuss some of that lifestyle aspect and what we could do to try to optimize things from that perspective. Like testosterone is really important for sperm production. And that's one of the misconceptions when it comes to, I don't know if it's a misconception, but something people don't know, is that when you take testosterone, say if you take injectable testosterone, that actually shuts off your sperm production. So I'll tell patients that, we'll talk about testosterone and its role in sperm, and they'll say, oh, do I need to go on testosterone? So no, actually you don't. Like it's your own natural testosterone that will actually increase your sperm production. So there are medications I give patients, something called HCG, which you guys have probably had. I don't know if you guys ever talked about that before, but it's another injection. So it increases your own natural testosterone. And there's other medications I'll give. And the goal of that, it could be twofold. It could be that somebody has low testosterone, but they want to maintain their fertility, or maybe they have low sperm counts and we're trying to boost it. So there are a few different options there.
There's another myth that it's not on our list, but it's something that I've heard often, and it's if the male is able to grow facial hair, or if they're that's one of them, is that if they have the ability to grow facial hair, it's a sign of high testosterone in their body. Is that true or is that false?
Yeah, it's false. I mean, a lot of these things are so, a lot of it's genetics based as well, right? So we just don't know, right? It could, we were thinking about hair loss and, especially hair growth patterns and so forth. A lot of it just has instilled in our genetics that, is it all hormonally regulated? It's hard to really say.
Well, and you said lifestyle plays a very important role. What are some things that men can do in terms of just small things, small actions, doesn't have to be major, that they can ensure that they have a healthy lifestyle?
Yeah, I think just the biggest thing is just getting your steps in. I think it's just keeping it, I'm sure same with you guys, right? Or maybe I'm older now, but like, back when you're younger, you think about all these different like exercise. Oh, I got to plan this out. I got to do this. I got to hit my chest, my tri. But it's really about keeping it simple. It's like, I need to get my steps in. What's that steps? We talk about 10,000 steps, but it's, just trying to be consistent, whatever it is. It doesn't need to be grandiose. I don't need to go to the gym an hour, 5 to 7 days a week and, kill myself and making sure I'm getting my 200 grams of protein in. It's making sure whatever you're doing is consistent, that you can keep it on for a long time, right? And what if it's just after dinner, you're going out for like a half an hour walk with your family? Just very little simple things, because that adds up, right? If you're walking, 10,000 steps a day, that's several hundred calories that you're burning. If you add that, times that by, 365 days a year. So I think it's just little things, except right now it's challenging because there's just too much stuff out there and you don't know what the right answers are. So I think it's just starting slow, being consistent, and try not to burn out too quickly. Not trying to hire that personal trainer at 5 o'clock in the morning and then just never going back.
Yeah. What is your thoughts on the social media world and the aspect of men's health? Like, you go on social media right now, I bet if I pull up my Instagram, there'll be a reel of some guy saying,
because our phones are listening to us.
There'll be a guy saying that, hey, like, take this, you want to get jacked? Like, what are your thoughts on the social media aspect and how that influences the characteristics that walk through your door and the client-doctor relationship in that sense, where, you're trying to tell them one thing and they're like, hey, well, TikTok's telling me to do this. Like, what are your thoughts on
the
that?
internet doctors? Everyone's an
internet doctor, right?
It is tough. I mean, it's a pro and con, right? Is it great if someone comes in and shows me something that maybe I didn't know, that I'm like, actually, let me look at this to see where is the validity in this. But it could be a con. It's like, there's no evidence for this. And we often get into a lot of that conversations about testosterone, right? And, patients will say, if we talk about total testosterone, well, what about my free testosterone? And that's valid, but there's a lot of reference ranges that don't exist. So how do we interpret these values? So people may say these things on social media. It's easy to say it when we don't really know, right? So I think it could be a bit of a double-edged sword there. It's great in the educational aspect, kind of what you guys are doing, and what a lot of people are doing is they're trying to get the proper message out there. I think the tough part is just that it provides us a lot of forum, but how do you sift through that? And it's a tough question.
We were talking about lifestyle briefly, and I want to touch on the world of being a doctor and the lifestyle that is almost 24/7. Like, doctors work an absurd amount of hours per week. Can you touch on your lifestyle right now and what your day-to-day looks like? I know I asked you briefly before the podcast, but what does your day-to-day look like? How much time are you spending here? How much time are you at SSC? How do you balance your time like that?
Yeah, so it's a bit variable. Like, as a urologist, well, I'll tend to operate usually about 2 days a week. So typically, Mondays we operate, so I'll operate at HSC. Usually we go to like 7:30 to 3:30. My Tuesdays I'll usually be in clinic, where I'll do something called cystoscopy. So that's a little fiber optic camera that we can take a look at the prostate and the bladder and those internal structures. So kind of do that during clinic. Wednesdays I usually spend doing resident teaching. So we have the morning where we're teaching our residents, and in the afternoon I usually do a lot of research. And then Thursdays is we're back in the operating room, usually 7:30 to 3:30, maybe some clinic after. And then Fridays could typically be clinic or procedures where we're doing minor procedures. So it's a bit variable. Most days could run from like 7:30 to 5:30, and then when we're on call. The nice thing about call is that, most times we're able to manage a lot of things, over the phone, depending on what comes in. And sometimes we'll have to come in on call and deal with things that happen overnight and emergencies.
How do you do it? How do you do all of this? How do you do all of this and still, I don't know, remain sane? If that's something, if that's the right way to put it.
I think you get used to it, but I think it's also, it's a humbling job. You get a lot of patients that depend on you that are very grateful. So I think it's just one of those things that, like, once you start practicing, you kind of get into this pattern. And then once you're in a collegial work, and we have a very good group of urologists in this province, we all get along very well. So it's just like everything else. And that's why I picked urology, because I found it to be a very good group of people that are very supportive. My partner in the clinic and I were best buds. So it's nice to work with a good group. And so, after a while, you just find that it's not really work anymore. It's just kind of, you're doing what you like.
Where did the idea flourish of starting this facility? Medicine's very traditional. You have the job lined up. You can go to the hospital and you'll be set for life, right? But you went out of the way to foster and grow your own brand and, create your own clinic. No one has to do that. Why did you decide to do that?
Yeah, no, it's a good. So myself and Dr. Nayak, we trained here together in residency. So him and I talked about this probably for like 10 years ago. And we always talked about this idea of a clinic and kind of what we wanted to do. And then he started here a few years before me. And then when I finished training, we kind of just said, we need to do this. And it kind of came back to the idea of men's health. Like, there's so much information out there, but there's very little care directed towards that. Like, what is men's health? And sort of, we kind of created, what do we think is men's health? Like, how do we want to target this topic? And there really isn't a roadmap. And so that's kind of what it's a challenge. It's like, how can we develop this and create this idea and this vision? And it just kind of snowballed. It went from having only a couple staff to now 20, 25 full-time, part-time staff, and just really delivering care as the way we see it. And we see it from our patients, is that they're just so happy that something like this exists. I think the trouble is there's just so many people out there that need care. How do you deliver it to everyone in a timely fashion? And so it's just it's good problems to have, but it's things that we're always trying to navigate on. How can we improve at the end of the day, the patient experience and kind of how we're trying to deliver care.
Can I ask you about what your conversations were like with your partner before this was a thing? Like, what do you guys say to each other when you have this dream before it's an actual reality?
I mean, it's probably just like how you guys started the podcast. It's just like you just have an idea. It's probably very rudimentary, and then you just you just feel right about it, right? You just feel right that you're like, I know that. And that's the one thing about when we think about when you train this much and you're so focused on your specialty, who knows more than the specialty than yourselves, right? Yeah. So even though we didn't know, we're not businessmen. We didn't know if this was going to be a business that's going to survive.
Yeah.
We know urology. Like, I know men's health, right? No one can take that out. No one can say that you do not know your specialty. I know more than anyone else. Yeah. And so in that sense, we just based on that fact that we know that we have so many patients looking for care, how could this not make sense, right? So, and that's taking the business part out of it. We just knew that there was a need. We see enough of it. Let's just do it. And so it just happened.
And that's honestly the best type of business to get into, is you found a problem and you provided the solution. A lot of that's what great businesses, for example, Apple, you look at Microsoft, there was a problem where technology is not provided to the users and they provided a solution, right? So it's a great aspect to get into, because even coming in from an engineering world, now the transition is like, okay, do I just go to consulting or do I start my own thing? And it's very admirable to see that you've chased your passions almost. So it's very commendable.
No, I appreciate it. I mean, it's always tough. I mean, you can't really neglect the business part. I think in the beginning, it's sort of what is going to get us to do this, So we started. And then after a while, or especially in the beginning, it's like, okay, well, let's start thinking about how are we going to make sure this is a viable business. And that's where it's slowly, you go to other clinics, you talk to your colleagues, your friends, people that, like, I'm not a businessman, but I can talk to people who know business, right? And so how do we, at Parallel, develop that while it's still taking away from our ability to deliver care and making sure it's a viable structure. So it's, it's they kind of have to go hand in hand, but I think the passion drives you, and then you figure out the other stuff on the side.
Do you often find yourself wearing those two hats at the same time, the doctor hat and the businessman hat?
Yeah, now things become a little bit more routine, a little bit, or at least we have it more structured, that we have people who are helping us out in the background that are managing the business aspect. But at the end of the day, you still have to, right? Like you still always have to be involved in the business aspect, because like we said before, like I know men's health, like I know where I want to go. No one can decide, oh, this new thing came out. How does this fit? Well, you still need to know, where's the data surrounding it? Does it right for our patients and so forth? So you do kind of have to have those both hats. But at least the nice thing now is that you're in that position. Whereas sometimes if you're working purely out of, say, a hospital setting, or a lot of places when I was down in the States, you don't have that option. It's they tell you what you can do. When you're kind of in this position, you can choose to, oh, this is a great treatment option. It's great for patients. There's good data. I can bring it in. I don't have to go through a whole, rigmarole process to bring something new.
What was the feeling like when you saw like men's health clinic on the front here? What was that day like? What was that feeling like when you were like, okay, we did this, like this is us now?
I mean, it was stressful because it all kind of happened during COVID, and so we were stressed.
Can you talk about that process, like how the idea came about, finding this place and all that?
Yeah, it just sort of happened. We found, I think we were just driving by, there was a space open, and we said, let's start looking at it. And then we kind of, said, okay, how do we go about this? And again, have no idea where to start, right? So you kind of have to talk to people that have other clinics and say, and hopefully they're willing to help you, which is really nice. At least Winnipeg is a very nice collegial environment. So we were able to talk to a couple colleagues that worked in the, that have had their own plastic surgery places, and kind of getting their sort of how they navigated things. But you find a builder, try to figure out how, and they ask you, what do you want to make? I don't know. What do you want? What do you want? So you do have to be more involved than you think, because you're deciding, well, where are the rooms going to go? Okay, what are the rooms for? So you're very involved in that aspect. And are there things we probably wish we thought of before? For sure, right? So you never really know until you start kind of creating it. But taking it from ground up, that part was the easy part. But then as we started having COVID was going on, started having delays in products and supply chains and all that stuff. So then building extended. So it's just getting more and more stressful. So finally, when it opened, we're like, okay, finally we can start doing some work. So it was a stressful process.
Was there ever a point where you thought, hey, maybe this is not, like, opening of clinics, this is not going to be for us?
Many times. Yeah. I think many times we definitely thought that. And then, once we started, it became so apparent. It was just, this was the best decision we made.
What were some of the first couple wins or positive reinforcements that you saw once the clinic opened?
I think it was mostly from the patients, right? Because it was myself and my partner, Dr. Nayak. He was practicing, so he practiced, like I said, a few years before me.
Yeah.
And so a lot of patients that we saw at our he's mostly based out of St. Boniface, myself HSC. So a lot of patients that we saw at our respective sites, it could be someone for the fertility we're talking about, right? So say you're seeing a 20-something-year-old patient coming to the Health Science Center for fertility issues. It's already scary, stressful coming to a major hospital, but something that doesn't need to be seen in the hospital. So right away, we were starting to see patients saying, oh, I feel so much more comfortable here. And then you see patients with penile curvature or Peyronie's disease. It's a very common condition. Everyone thinks they're the only person that has it. So as soon as they come here and they're seeing dozens of people in the waiting room, they're like, wow, I have no idea. Like, a lot of these things are very common. So you're just seeing all this positive reinforcement from the patient saying, I like coming here. This is so much, there's parking. I don't have to pay for parking. So just like the little things that you're just getting a lot of positive validation. And then, we're starting to get it from our colleagues, right? A lot of the primary care physicians in the province, other specialists saying, our patients are able to get to you guys so quickly, you're able to manage them. So you're just seeing so much positive reinforcement. So it just kind of kept snowballing.
Is there any negative reinforcement that says like, oh, this is horrible, I don't like this at all?
Yeah, I think because even though we're like a private clinic, we're still patients do not pay to be seen here, right? It's still a publicly, everything is through Manitoba Health. So sometimes when you're like private facility, but you're public, the people get really upset about wait times, but it's just out of our control. Ultimately, we're trying our best to get patients seen, but I think some patients sometimes get a little bit frustrated at wait times, which is understandable.
Yeah.
But at times it's completely out of our control. Whether you saw me here at Health Sciences or another urologist, we're doing the best we can.
Was there ever like someone who kind of contradicted the idea of like, why are you even starting a clinic? Like a lot of, nowadays, especially social media, men's health is something that's always kind of negatively talked about and not always openly talked about. Or in the sense that, hey, I'm a man, I'll be fine. Like, let me drink a protein shake, do a couple of dumbbells, and I'll be good. Like, my health is fine. But there's actual evidence, and you actually have to see a physician. So, was that ever apparent in the idea, or when clients walk through, they're like, yo, I didn't even know this could happen, and now it's actually happening?
Yeah, a bit of both. I think just as when you mentioned earlier, is that once you're sort of, there's so many physician jobs available now, right? So you can get set up in a hospital. So why even do this? So,
yeah.
For sure, people are you sure you want to do this, right? Like you want to take on that risk. I think there was always a lot of that in the beginning. Most people were, we were pretty adamant. We knew what we wanted to do. So most people were pretty supportive. Who knew what they were saying behind them, but most people were pretty supportive. But, from the patient aspect, like we said, like I think most people just don't realize how common a lot of these conditions are.
Yeah.
So they often feel kind of isolated and feel alone. So I think having that aspect, we're able to kind of get that awareness out.
Yeah.
How much of a risk was it?
It's always hard to say. I think it's, being earlier in my career, you'd probably say it'd be a less risk. I'm not later on in my career where, I can kind of come back from, a potentially a big mistake if that were the case. No, but I think, as we know that there's vast physician shortages across the country. So in the grand scheme of risks, I'd probably say not very much because you have patients waiting to see you and so forth. But I guess there's a lot of risk just in terms of just probably more so of doing something that potentially failed, right? Or that didn't work out and you were wrong.
Because now your reputation's also on the line as well. Like people are coming here to see you, to see the other doctors here, and if they have a negative experience here, kind of represents the brand and everything you've built.
Oh, 100%, right? You spend so much time training and developing that you didn't need to do this, and that you have a lot on the line, whether that's the financial line, but also just, like your reputation and so forth.
Well, and also the fact that you mentioned, you can, a lot of the times when you want to try out a new test, especially in the HS, you have to follow the protocols, but here you can make that decision and you're taking on a larger risk than you were at the hospital. How do you risk manage that?
I think just like anything else, you're just making sure that you always are doing your due diligence, right? It's that, if you wouldn't offer something to like a family member, never offer it to a patient, right? So it's making sure that any treatment option we talk about there has to be evidence to support it. Right now it's very tricky when we think about social media. There's so many treatments out there that are marketed for X, Y, and Z. A lot of them have no data for it. So, how are we being so adamant of these success rates or these stories? So I think the one premise or the one really big foundation that, Jay and Dr. Nayak and I have sort of laid out is that we're just not going to offer anything that we don't believe in. And we also want to be leaders when it comes to research. So doing our own clinical trials, trying to bring new treatments here to Manitobans, but doing it in trial format where patients are not paying for these new treatment options. We're trying to see, do they actually work? One really common condition right now or treatment is something called P-shot. I don't know if you guys heard of that before. So it's something called platelet-rich plasma. And so sometimes they'll do it for hair restoration, but for erections, very little data to support it. Like there's been some trials, but kind of mixed messages. One recently came out in the States where I trained, where it was a negative study, found no benefit. There's many clinics across the country that offer this to patients for thousands of dollars. There's no evidence really to support it in widespread clinical use. We will not offer that treatment because we just don't believe in it because there's no data to support it. But at the same time, we just submitted a grant. Let's do the study. Let's try to see if there's actual data for this. Because if there is, fantastic. Maybe this is something that Manitoba Health should be covering if there's actual legitimate data for. But I think things like that we have the opportunity here to, one, bring in new treatments, so something that we do for the prostate, so this Resume treatment. So it's been around for a long time, but it's a steam treatment that opens up the prostate. You know, we were the first clinic out I was the first urologist in Western Canada to start doing it. We're the highest volume place outside Ontario, but just new treatments that are available. So it's nice to be kind of at the forefront of that.
The next myth I have here is men can't suffer from breast cancer.
Oh, they can. They can. Yeah, you know, same as women. Obviously, to a less, you know, higher incidence of it. Very rare, but breast cancer can happen to men. Couldn't really give you the exact statistic off the top of my head, but certainly something that can happen.
Yeah, that's one of the ones that the internet wants to know. Yeah. I'll jump right into the second one as well. Erectile dysfunction only affects much older men.
Yeah, it's great question. So erectile dysfunction, I'm just going to give you the whole Coles note, right? Yeah. So ED, you know, we kind of, this is sort of how we preface it. You know, 40% of men over 40, 50% of men over 50, you can keep going, 60, et cetera. Sure. So why does it happen as men get older? And a lot of it probably has to do with, as men get older, they're more likely to have other medical problems, right? So maybe diabetes, maybe high blood pressure, cholesterol issues, those sort of things. But erectile dysfunction is largely, like, there's a few components to it, but it's largely a blood flow issue. So if you're having other conditions that are potentially causing blood flow issues, it's also causing problems to the penis, right? Yeah. And so that's why erectile dysfunction actually is an early warning sign of heart disease, okay? So, you know, a paper that we just published a couple of weeks ago, looking at actually Manitoba population, was that patients who had erectile dysfunction had a higher risk of having a future cardiac issue, okay? And the reason why is because the blood that supplies the heart, same blood that supplies the penis, except the vessels are smaller. So if you're starting having issues with your blood vessels, it's going to happen to the smaller organs first. So like your erections might be getting worse over time. Now, to go back to your question, does that an older man issue? No, it's certainly going to affect younger guys, right? But that's where we're not thinking more of a blood flow issue. Maybe we're thinking more of a psychogenic issue. So like I usually tell patients, when we think about what goes into an erection, think about the blood flow, right? So there are tests we can do to look at the blood flow to the penis. It's called the penile Doppler. We can look to see the blood, if it's going in properly, are the veins clamping down properly. Hormonal, right? You want to make sure you have adequate testosterone to supply. You don't need skyrocket testosterone. You need very little, but just making sure your testosterone's in the normal range. Gotcha. Nerves, right? You need to get the nerves firing to get the penis to work. There's no real test to look at the nerves, but that's where the history comes in, right? So maybe an older man has had prostate cancer. We remove the prostate. You could damage the nerves there. You may have issues with erections after, right? So we're thinking about those components. Think about the pelvic floor. So the pelvic floor muscles, they're really responsible for peeing, ejaculation, going to the bathroom, but also really keeping that penis and the structure supported. So the pelvic floor is important. But then, the other component is just psychogenic, right? Yeah. You need to get that working as well. I have patients that say, when I'm having intercourse, I lose my erection. And then when I ask them, what about masturbation? Like, oh, that's fine. Right? But just trying to create those links. Like, okay, well, why are you having problems there? Why are you not having problems there? Is it because of a stimulation issue? Are you just not having the same level of stimulation during intercourse that you are masturbation? Yeah. And that's what's keeping you erect? So younger patients, we certainly think more psychogenic than I think a truly blood flow issue. It's very rare to have an organic or like a physical cause for erectile dysfunction in a younger patient. But there's a big conversation in there to kind of really try to figure it out.
I think it's great that you mentioned the psychogenic aspect of ED. Is that even now a lot of users, I think they're relating to the pornography, right? A lot of young males are coming out with addictions to pornography and how that influences your performance in the bedroom. It's do you think that's correlated, or is that I guess the question put it in the question is, do you think pornography has a direct effect to ED?
Yeah, I mean, like anything else, is porn bad? No, it's all moderation, right? But like, what can it cause? Well, number one, you may have a complex, right? Just be like, my penis does not look like that, right? So number one, you're already starting to feel, right? Yeah. You're already comparing, right? So you're like,
I hate when that happens.
Yeah, yeah, exactly. Right away, you're like, man, that sucks, right? So you're already one concerned about your penis life.
Yeah.
You're like, why is that guy? I've been on break for an hour and that guy's still going, right? You're like, how is this possible, right? So you're already concerned about premature ejaculation. So you got two things already off your right.
Yeah.
So I think that's where porn can have some issues, right? When you're comparing yourself, and when you have really no one, what kind of group of guys are sitting around talking about how quickly they, ejaculated, right?
Every week.
Yeah.
It's the weekend.
So I think it kind of it definitely leads to some problems in that sense. Certainly number of patients I talk about is that they'll always talk about premature ejaculation. As soon as we actually talk about the numbers in the minutes, I'm like, you're well in the normal range.
Yeah.
But they don't know because there's nothing to compare it to. What are we thinking about penis size? Most people are in the normal range, but every single human being is going to think they have a small penis, right? So I think the pornography aspect is going to be the moderation, but when we come back to that stimulation, like I think that what pornography can do, or especially with masturbation, is that you may not be replicating that during intercourse, right? Because it's not uncommon for patients to say, "I'm not feeling it during intercourse," and so that's where we have to sound about, okay, why? Like, what's going on? Is it because of masturbation, positioning? So all these sort of things come up. And that's the one nice thing about the clinic, is that patients feel comfortable when they come here, they can have that conversation.
Yeah.
I think the one trouble is, especially with erectile dysfunction, as soon as you Google ED, you're getting so many ads on Facebook for getting pills shipped to your door. Like discreet delivery, this. Oh, don't worry about it, just order online. So, but it's saying discreet delivery for a condition that's so common that we should be talking about and trying to figure out the root cause, as opposed to just trying out a pill, right?
Is that treating the symptom, or is that just treating? Oh, I'm messing up my words here. Is that those pills and those injections or those procedures, are those beneficial in, let's say, curing ED?
They won't cure it. It's just treating it, right?
Treating it. Now,
sorry, yes. Yeah, is there a role for it? Absolutely. But if you think about a young patient, say if a 25-year-old guy who's having issues with erections, if I give him a prescription for a Viagra, what's the stop date? Right? It's going to be for the rest of his life, potentially, right? Now, if it comes with a thorough conversation of, you have a young patient, they're not in maybe they're not in a long-term relationship, they've tried everything else. We've talked to the psychogenic component. They talked to a sexual therapist. Things aren't working. There is a role for pills, right? Sometimes what I'll do is I'll start them on a course because you can take Cialis on a daily basis. So you don't have to take it before intercourse, right? So you don't have to plan for it, right? You just take it. It's in your system for 24, 48 hours. Maybe we get them on, a couple months system of that, getting more confident with how things are working, and then we start weaning it off, right? So there certainly is a role for it. I think ideally it should it should come with a plan to stop it in those, in the younger patients. In the older patients, this may be it. Maybe this is this is how it goes. But
this leads into our next myth, that masturbation decreases sperm count.
No. So when it comes to ejaculation, or the frequency, it typically takes about 24, 48 hours for sperm counts to go back up. So when patients are, when the couple's trying to have a baby, I usually tell them during around ovulation, which is the time when the egg's going to be there, is making sure that you're having intercourse every other day, just making sure the sperm counts are kind of as optimal as possible. But, masturbation is not going to drop it.
So does masturbation decrease fertility for men?
No.
Okay.
No. But what can happen, though, is if you do it too quickly, right? It can, if you do it on the same day, or, that can cause some issues. But at least waiting 24 hours is ideal.
What if you wait more?
No,
is there a direct correlation, like graph-wise?
Yeah.
What is a y squared?
I mean, some people say after 7 days, but
What's x squared?
Yeah, exactly. Not so much. They usually say maybe after 7 days there'll be an issue, but not.
Okay, just curious.
Mx plus b. That's the.
Well, he's the engineer, so I was like, let's pull out the equation. When a lot of these questions, when it comes up to, is about erectile dysfunction. That's what a lot of men are searching, and that's what Google seems to provide to me. How comfortable were you when you first started in the world of having these conversations to, let's say now, for example, in terms of telling people that, hey, listen, like, this is what I do for a living?
I think I was always that's kind of why I drifted towards urology.
Yeah.
I kind of felt that, I could, I enjoy talking to patients and talking about some of these sensitive topics and so forth. I think everyone comes in and as soon as they start talking about erections, their kind of voice goes down. But, once you start opening up, but once you start talking about patients are very open, I think, and that's the one nice thing, and that's the one humbling thing about being a doctor is that you've just met this person 5 seconds ago and they're telling you everything about so you're really in a very
They trust you.
right, and they're very vulnerable, right? So you have to you kind of go to every patient how they are, right? Patient comes in super friendly, you're going to be more out there, more jovial, someone's more reserved, so you kind of have to tailor to the patient specific. But I think over time, you just get more experience, right? You get more experience of what works, what doesn't work, trial and error. And as time is going on, like more research and stuff is being done so that you can hopefully use that.
Would you say your job now more is relationship building in terms of with your clients, allowing them to open up more, or is it just strictly the client-doctor relationships that you focus on?
It's it'd be ideal if it was more of the form, trying to have more of those relationships. I think the toughest part right now is just the sheer volume of patients that need to be seen. So as much as you want to give patients the ability to really connect with them as much, to give them a lot of times it's just you're trying to get patients seen, right? So you're just trying to get them dealt with, because there are a lot of urgent things. We do a lot of testicular cancer here as well, some bladder cancer. So you are trying to get patients in a timely fashion. So sometimes you're not able to really give that whole, as much time as you wish you did.
When it comes to learning that skill of people interactions, human interaction, how did you learn that skill? Or was that something that was taught throughout school? Because in school, I'm sure it's a lot of facts and this is what's about psychology, anatomy, things like that. But what about the relationship building? What about knowing that, like you just said, if someone's more open, like being more open with them versus reserved? Where did that learning curve come in?
A little bit in school, like during medical school, you will do some OSCE stations where you'll kind of navigate through patients, and then as a resident, you'll be actually interacting with patients basically on a daily basis. But then once you start practicing, you kind of get into the realm of, or you kind of get into the feel of it, right? And then now that I've been practicing for about 5 years, some patients I've seen when I first started, so you start developing those relationships with the patients. I think it just comes over time. Once you start seeing so many patients, you just get so used to it.
Could you also touch on the difference between, let's say, the Canadian healthcare system and the United States healthcare system, and your thoughts on that?
Yeah, so the Canadian healthcare system, single payer system, so basically provincially or what's federally funded, provincially regulated. US a little bit different, private. There's also like Medicare and these sort of things where there are some government assistance. I think the one very nice thing about Canadian healthcare is that the education system is quite standardized, right? When we think about medical schools, when we think about residencies, and so forth, you know what you're going to get, right? Across the country. And it could also be because we're a smaller country, like we know all the urologists in the country pretty much just because it's such a small group. But I think it's because all the training programs are pretty well regulated. So I think that's one nice thing here. The US, a little bit different. You're going to have the top tier, and then you're going to have everything in the low tier, and you have everything in between.
Yeah.
So sometimes you don't know what you're going to get. But I think the one very nice thing about the US is that you can get access to care quite quickly, right? So it's very not too difficult to see specialists and get seen in the emergency department down in the US. It's more costly.
Yeah.
Here, trouble is wait times, as we're kind of seeing. Wait times are just getting higher and higher and higher. And so that's the one challenge with the Canadian healthcare system. And that's kind of why we built this place as well, is that we have an operating room here. So we've been doing a lot of procedures here to take them out of the kind of the major hospitals. I think the one challenge between the Canadians' healthcare system versus the US is that we don't have enough doctors and nurses here. I think that's also an issue down in the US as well, but it's a clear shortage right now. And as the population continues to grow, we just need more healthcare professionals.
Why do you think that is?
I think it just probably outpaced it. Whether it's a limited medical school seats, it's always just been stagnant potentially, right? Now that there's more schools opening up, more seats being available. But then with that needs to come more the end line. You can't hire more surgeons if there's no more operating rooms, right? Or you can hire as many as you want, but if you don't have enough resources to support them, how's that going to work? So it kind of has to all come in tandem. is that you kind of have to think about it all throughout. And so that's ideally the way things are going. But the other aspect is you kind of want to use facilities appropriately as well. When you have a limited amount of dollars, you don't want to use very expensive resources for not very invasive procedures, right? So that's where, we've been doing is a lot of procedures here to take them out of the hospital, try to shift the focus out of the major hospitals to smaller operating rooms where you can do these procedures safely, using them more effectively for the bigger procedures. So, it's we'll see how the future goes. Clearly, there's a lot of eyes on healthcare right now. Of course. But my firm belief would be to stick with a government-funded healthcare as opposed to what we're seeing down in the States.
Do you think the issue will ever get resolved? Will there ever be a system where you don't have to wait?
I think you're always gonna have to wait. I guess it depends on what is the reasonable wait time, right? I think, the ideal goal people say is that, you should be able to get a second opinion very quickly. Right now we just need to get a first opinion, right? So I think maybe in the future once we have a way, but we have to start thinking things a little bit differently. And the other aspect just has to come with education, right? Like patients need to be educated before they come in through the doors. Because what if they have something that they're not concerned about or they don't know, right? So, what we try to do here especially is that we try to pre-educate patients as much as possible. So we send them, we create YouTube channel, YouTube videos, brochures, anything, because the more educated they come in, maybe they will be able to make their decision based on what they want at that appointment, as opposed to, say if I see someone for the first time, we're talking about their condition, they talk about the erectile dysfunction. It's like, okay, I need some time to think about all the different treatment options. Okay, I'll see you back. Well, that second appointment could have been for someone else. I could have treated that person on the first one. It may not go that way, but if you're trying to make things as efficient as possible when you have a lot of patients to be seen, so there has to be smarter ways of delivering care.
So do you feel like social media is having a play on that aspect of, delivering the education right away? Or do you think social media is kind of oversaturating the market with what the client receives? Yeah,
again, great question. So a study we did here too about misconceptions in sexual health. I think some patients in our survey, our patients found that it was very confusing, too much information out there. So that's why we elected to create our own content. Because again, when they see us, they're going to be comfortable with what we send them. The other nice thing is that once you make a YouTube educational video, for me talking to them already on a YouTube video about their condition and then seeing them, it already starts building that pre-trust in it. That they're like, okay, this guy sounds like he knows what he's talking about, right? So I think that assists in that aspect. But I think the social media part or Google was challenging because they didn't know what to believe.
What was it like getting in front of the camera and talking about it and getting into the world of content creation?
It's tricky.
Yeah.
It takes a little bit of time of kind of knowing how to do the proper cues, what to say, slowing down, those sort of things. But I feel like it takes a little bit of time getting used to it.
Do you enjoy that part? Do you enjoy that part, that hat you wear? Like you wear the doctor hat, you wear the business hat. Do you enjoy the content creation side?
I don't like watching it. I don't like watching.
Don't watch it back.
I watch it and take a look at it, make sure I was saying the things correctly. But I find it tough to watch myself. But yeah,
just a question I ask because this is what we do. Sometimes ourselves, even when we first started, like, oh, I hate the sound of my voice. That's not.
100%.
That's not something I want to do. But
even when people or some of our friends are like, I listen to every episode. I'm like, no, you don't, because I don't even listen to my own episode.
First of all, why? But yeah, no, I can understand that. That's it's another hat that you wear, and I want to commend you first of all. Talking with you for the last couple of minutes here, I've noticed that not only are you willing to find an issue, but you're also willing to find the solution as well. Whether that there's a lot of things that are going wrong in hospitals. Let me see if I can create a clinic here. People need to be educated. Okay, I'm going to create content for that. So first of all, I commend you in that sense. And I aspire. The last one I have here, which I think we might end it off on here, is hot tubs and wearing tight underwear lead to sterility.
So not really the tight underwear. Tight underwear is fine. No real concerns from that. Everyone's wearing sacks these days, so that's supportive garments.
Yeah.
When it comes to the hot tub, no real concerns. Now, again, everything's in moderation. So there's something called varicoceles. Okay, and this is a bit of a different example, but varicoceles are dilated veins around the testicle.
Okay.
it's one of the leading causes of fertility. Okay, the reason why testicles are outside the body because they want to be in a cooler climate. You have these veins surrounding the testicle that's exposing it to heat basically 24/7, and they can cause fertility issues in 60 to 70% of the time. Okay, so if they can only cause fertility issues 60, 70% of the time, and you have heat exposed to the testicle 24/7, a hot tub periodically is not going to cause any problems. So that's why I usually tell patients, if you're in a hot tub, unless you're in a hot tub like 5 hours a day, like I can't see how that's going to cause any problems. So periodic soaking is not going to cause any issues.
Do you think like the biohacking people are doing now with like, red light therapy or like even the cold exposures to boost the, what it's called, brown fat, I believe, in their bodies? All these biohacks that are, the new norm of social media nowadays. What are your thoughts on those?
It's just so hard to even know, right? Because
Yeah.
it's such short, all this stuff is so such short temporal, such small patients. Like we don't know, until we start seeing with some longer term stuff to see what the outcomes are going to be. I think nothing at the end of the day is going to trump just standard, proper sleep, proper nutrition, cardiovascular resistance training, and limiting stress. The foundation of health is going to be those aspects. Sure, there's going to be some other things that we're going to find out that maybe that could improve some outcomes down the road. But I think the foundation is the killer, the pillar right now, and everyone should be focused on that.
I've reached the end of my list, but I will ask you this one question. Is there any myths that you know of or that you have seen in the world that maybe need a little debunking?
Yeah, I mean, one probably think about vasectomies. You guys are young, so you guys don't have to worry about vasectomies. But a lot of misconceptions about vasectomies. People think it's going to decrease your, ejaculate. It's not going to. They think it's going to cause prostate cancer. It won't. It won't drop your testosterone. So a lot of safeties when it comes to vasectomies. A lot of patients always get concerned about it. It's a very simple office-based procedure. It takes 10 to 15 minutes to do. Minimal side effects. So one common question that a lot of patients ask about vasectomies.
Is there anything that we haven't touched on throughout this episode or anything that we haven't asked you that you think we should ask you about?
That you wanted to talk about?
Oh, that's a tough one. I think just starting the conversation. I mean, what you guys did is perfect. I think it's just getting these conversations started, that patients know that there's options out there, or even if you're not experiencing anything, but just knowing that these conditions are more common than we think they are, and that there are treatment options for them.
In terms of your journey to get here, what's the future looking like for Men's Health Clinic, yourself? There's some of the research you're doing. Where do you want to take this, and what are some more solutions you want to create in the world?
Yeah, I think we talked about, number one right now is just getting the patients seen in a timely fashion, right? Let's just get patients seen. Let's kind of get people the care they need. But then what is the future of it? Well, ideally, patients need primary care doctors. Someone needs to, a lot of patients don't have family doctors right now. So in the ideal world is that getting patients primary care, that they can get the baseline care, someone monitoring it. But then we're talking about preventative health care. What can I have done 5, 10, 15 years before? What could I have ingrained in my daily routine that may pay dividends in 30 to 50 years that would make me, be able to be playing with my grandkids or great-grandkids, right? So trying to think about what can we do for our patients as, at what time frame to get them to where they want to be when they're retiring, right? And I think, so it's sort of an idea that we're trying to figure out is that, and that's where that element of longevity and all these sort of things kind of come in. But I think that's kind of where we want to take it at some point.
Wow. Is there any advice you can leave the audience with in terms of whether it's their health, their business, or their life in general? Any advice that you can leave the audience with?
Yeah, I mean, do I look at the camera? Do I
Anywhere.
Give us some advice.
Give us advice. Yeah. Any advice you can leave us with in terms of continue to develop our health, be young, healthy males?
Yeah, I mean, you guys are obviously, for the first part of your time, well, you guys are already doing it, right? If you have an idea or something you want to do, there's no better time than now, right? There's so much opportunity to connect with like-minded people that, a lot of people have the same, a lot of people want the same thing, right? And so if you can find people and join together, I think the biggest thing is just finding people that you can trust and run with. And I think that's what worked out here, especially, of that, being able to start Men's Health Clinic with one of my best friends and great colleagues. There's no better feeling than there's no better feeling than, doing something right, but feeling something even better than that is doing it with somebody that you can share it with, right? And so I think doing it with somebody else has been fantastic. But I think there's no better time than now than to really take a dive at something. When it comes to the health aspect, I think it's kind of what we talked about. I think it's just laying the foundations now, right? Whatever the routine is, what can I do that's going to be sustainable and keep it going? Because I think it's very easy to get to a point in your life where, you may take a break from going to the gym for like a couple years, and then it's hard to get back in. But what can I do that could be sustainable? And then just keeping it easy or keeping it simple.
Alrighty. Well, thank you so much, Dr. Patel, for giving us the evening and your time. If you haven't already, please check out Men's Health Clinic. We'll tag everything in the description below. If you need some advice, Dr. Patel is here. And until next time, peace.
Peace. Thank you. That's a wrap. Thank you so much.
Good. How was that? Is that okay?
Yeah, hopefully we didn't take up too much of your
No,
time.
it's all good.
I appreciate you.
How was us?
No, it was good. No, thanks, guys. That was awesome. Yeah.
Perfect. We'll grab a couple pictures just in front
Yeah,
of
100%.
and then
Yeah.
we'll wrap everything up and get you out of here.
Yeah, no, 100%.
I'm glad we were able to do this.
Yeah, no.
No, thanks, guys. Yeah, I know. It took you. Yeah, no, we figured it out.
I was like, I don't want to keep texting this. I know he's busy, but like,
No, man, it worked out. No, thanks for
Yeah, we'll put everything back. We'll get you in the middle.
Oh,
where is he?